Prostate is a gland, usually the size of a walnut, that sits underneath the bladder. It surrounds the urethra, that's the tube that you urinate through. An enlarged prostate is where the size of the prostate increases over time. You may also hear it called benign prostate enlargement or benign prostatic hyperplasia. This is a common condition in men over the age of 50. And an enlarged prostate is not cancer. It doesn't increase your risk of getting prostate cancer. If the prostate does become enlarged, it can place pressure on your bladder and your urethra, and that can lead to urinary problems. This is the most common cause of urinary problems in men as they get older. And possible symptoms include a weak flow when you urinate, a feeling that your bladder hasn't emptied properly, or some difficulty starting to urinate, dribbling urine after you're finished, or needing to urinate more often than usual, especially at night. You could get a sudden urge to urinate, and you may find that you're leaking before you get to the toilet. You may not get all of these symptoms. Some men with an enlarged prostate don't get any symptoms at all, and there may be other reasons for your symptoms. So speak to your GP to find out what may be causing them. You may have several different tests to find out if you have an enlarged prostate. When you visit your GP, they may ask you to describe your symptoms and keep a diary of what you're drinking and how often you urinate. And they may also test your urine. Your GP may also carry out blood tests to check your kidneys are working properly. You may also be offered a PSA blood test to check the amount of prostate-specific antigen, PSA, in your blood. Your doctor may also want to feel your prostate. This is known as a digital rectal examination, or DRE. Depending on your test results, you may have further tests at the hospital. Your GP will be able to explain what further tests you need. There are three main types of treatment for an enlarged prostate: lifestyle changes, medicines, or perhaps surgery. There are simple changes you can make to your lifestyle that may help with your symptoms. For example, drinking less alcohol and caffeine, or artificial sweeteners and fizzy drinks. All of these can irritate the bladder and may make urinary symptoms worse. It can also help to exercise regularly and keep a healthy weight. With medicines, if lifestyle changes don't control your symptoms, medicines may be an option. The main types of medicines for an enlarged prostate are alpha blockers. For example, tamsulosin, which relaxes the muscles in the prostate and around the opening of it to make it easier to urinate. Or 5-alpha reductase inhibitors. Another example is finasteride, which slowly shrink the prostate so it stops pressing on the urethra, and that makes it easier to urinate. There are a number of different types of medicines that can be used to treat an enlarged prostate, and your doctor will talk to you about which is the most suitable for you. With surgery, if lifestyle changes and medicines don't control your symptoms, or your symptoms are particularly severe, your doctor may suggest surgery. There are a number of different types of surgery used to treat an enlarged prostate. The type of surgery available to you may depend on the size of your prostate and any other health problems you may have. The most common surgery is transurethral resection of the prostate, also known as TURP. This involves the removal of parts of the prostate that have grown too large and are pressing on the urethra. Your doctor or nurse will discuss the advantages and disadvantages of each type of surgery that they offer, and that will help you decide what's right for you. For more information, speak to our specialist nurses on 0800 074 8383 or visit our website on prostatecanceruk.org.